did all of that.
Right.
And
so
he showed me how to go through and
change him and then increase duration or increase motor unit potential.
Right.
Yes. Or motor unit potential or both.
Or both.
And the interpretation is going to be possible radiculopathy at TA, which is innervated by O5S1. Like we gotta make it very bold statement like that. So now we have a timeline about what's going on. This is going to be 3 weeks, which is going to be, like we said, the spontaneous activity, 3 weeks to 6 months. We do have 6 months to 12 months, to 18 months, which is going to be satellite waves, serrations, and increase in the MUP or the motor unit potential.
Right.
Any questions about this?
No.
Perfect. Now, let's talk about a couple of other things. And we talked about if the paraspinal muscles are going to be involved, they're going to be involved early on, and then they're going to be very quiet later on when the issue. When you see a lot of fibrosis with the ultrasound exam,
it's old.
it is old, and most likely you're not going to see muscle activities when you do the needle for the paraspinal muscles. Now, let's talk about the NCV interp. This is going to be the stuff that we did with the nerves, the sensory, right? So, we do have a wave that looks somewhere like that, which is like a hill, kind of like 2 hills on the bottom, 1 hill up top. And for the sensory, most sensory are going to have a wave that the axis of that wave is going to be 2.4 milliseconds.
Okay.
So if it's between 2 and 4 milliseconds, we're going to call this what? Normal. If it is plus 6 seconds, and I'm giving 2 milliseconds, like, average.
Yeah.
If it's way delayed right here, plus 6 millisecond, this is going to be what?
Abnormal.
What does abnormal mean?
Delayed. Delayed sensory?
Delayed sensory, or what we call it here is what? Increased latency.
Increased latency.
It's backwards.
Right.
Right? So shortened latency is good. Increased latency is bad.
Yeah.
Decreased latency.
It means the same thing.
It's the same
taking too long, yeah.
It's taking too long.
It's latent.
Right. Taking too long means what?
The nerve's not getting through. The signal's not getting through.
So guess what? There is carpal tunnel right here. We have one of 2 choices. It's either we're gonna open it up.
It's happening right there, yeah.
Or we're gonna do what?
Treat it. Exosomes or PRP or something, yeah.
So we're gonna do all of the above. We're gonna do exosomes, PRP, or either, whichever.
Yeah.
Right? And then we're gonna do the splint. We're gonna do acupuncture. We're gonna do physical therapy. We're gonna do laser.
We're gonna put TPI right up here in the traps. They're gonna feel great.
Right? That's carpal tunnel with the ulnar nerve. Let's check something out. We're gonna talk about the ulnar nerve motor now.
Okay.
Right? So with the ulnar motor nerve, so this is sensory, this is for all of them.
Which we've tested 3 times.
Right. No. I'm just reviewing for a second there, right?
Okay.
So the sensory here is going to be median, and it's going to be ulnar, and it's going to be radial. They're all pretty much kind of the same. It's like that 2.4 plus or minus. If it's delayed, there is increased latency. If there is increased latency, there is an impingement. If there's an impingement, we need to treat.
Yes.
Now, the ulnar motor.
Yeah.
We tested how many times?
3 times.
So, the first one is going to be where?
Elbow. Go on. I don't know. I'll have to review.
Well, we're gonna get there. Wrist.
Wrist.
second one is going to be where?
Mid-arm and then elbow. Wrist, mid-arm, elbow.
So this is what we call below elbow, and we call this above
Okay.
elbow. Simple.
Mm-hmm.
All right. Now, I'm gonna try to tie up all up, and I hope it doesn't confuse you. So, when we check the ulnar at the wrist,
Mm-hmm.
the impingement is gonna be here. I believe this is called the tunnel of Vaillant.
Mm-hmm.
And then we're gonna go to the least needy part to stimulate where the prongs go,
Mm-hmm.
right? And then we go here under the medial epicondyle.
Mm-hmm.
So, you know where the funny bone is?
Yeah. I'm on it.
This is it.
I feel it here too.
Less amount of. Which one has more bone?
Well, this one.
Right. Go where there is less bone, and then hook it right there.
Oh, right.
Right? Now, by design, the ulnar nerve is on the inside of the arm, not on the outside.
Mhm.
Because if it was on the outside and we fall on it again, we'd be paralyzed.
Be a radial. Okay.
Right? So you go between the biceps and the triceps.
Oh,
And then if
okay.
you stick your finger a little
Yeah.
bit too much, you're gonna be like, that hurts.
Yeah.
Remember when we were little kids and then they would
Yeah.
squeeze us right here?
Mm-hmm.
That's where the ulnar nerve is.
Okay.
That's above the elbow.
Okay.
So here's the ulnar.
All right. I
Here's
got
the
it.
ulnar.
I'm not
Here's the ulnar.
confused. I'm not confused. I got the wrist. Yeah. Okay.
Same nerve.
Got it.
Like, you try to do this with like a little kid and you squeeze in between their biceps and the triceps and their arm just falls
Yeah.
out.
So this is where we're.
This
that's
is what
the
we're
three.
working on.
Yeah.
These
so
are the three,
wrist. Yeah.
right?
I'm gonna write that down. Wrist. Elbow. Above.
Above,
Below.
below,
Below
elbow.
elbow. Above. And this is deltoid and bicep. I'll understand that later.
So, if now, so all three should be the same waves, right? And then we said this is going to be frequency, this is going to be time. So when I put all three in here, I put this is with the least amount of latency.
Mm-hmm.
This is a little bit with increased latency, and this is not so much because the difference between here and here is usually a full forearm,
Mm-hmm.
and between here and here is only 12.
Right.
Right? So these are going to be between the second and third sites.
Okay.
It's not going to be as much of a difference as between the first and second site. Are we good so far?
Yeah.
Now, for some reason, this is going to be a tricky question.
Okay.
For some reason, this is a good wave at the wrist. The one below the elbow is very diminished,
Mm-hmm.
and the one above the elbow is good, as big as the wrist. Why is this decreased?
Injury at the elbow.
If there's injury at the elbow, the one above and the one at the elbow are going to be
Oh,
decreased.
right.
It's the same nerve.
So decreased is
Abnormal.
abnormal. I don't know. The nerve root.
It's a technical error because of the performer.
Oh, okay. I was gonna say it. I have no
Exactly.
idea. If it was the nerve root, then the above would be upset too.
Exactly. Right?
Yeah.
If the problem is at the wrist, all three of them should be bad. If the problem is above the elbow, this is the only one that should be bad. If the problem is below the elbow, the two of them should be bad at least.
Okay.
But if the one at the elbow, the one below the elbow, is the only one that is decreased,
Oddball. Yeah. Operator error.
it's operator error. You
Okay.
did not stimulate the nerve at the right spot.
Okay.
That's what it is, and we just know it.
Okay.
Doesn't happen a lot,
Yeah.
right? But it's gonna happen enough times when you've
Yeah.
done this that you're like, huh, how do I get rid of this? Two ways.
Okay.
instead of simulating the ulnar nerve from the side, go a little bit below under the medial epicondyle. So do you see where my fingers are?
Yeah.
One is on the forearm, one is right at the medial epicondyle.
Yeah.
Here. Ow. Now,
In between or on it?
no, in between. Like, see
Okay.
that groove?
Yeah. Yeah, you got it large, very.
It slided right there.
Yeah.
Right?
Okay.
And then increase the juice a little bit when you
Okay.
stimulate. Because this has a lot of meat sometimes.
Yeah.
And then the third thing is I bend the elbow,
Mm-hmm.
and then I would stretch the nerve more superficial.
Okay. Easy peasy.
Easy peasy, right? So, 3 things I'm gonna do. If this is right there, I'm gonna really hook.
Mm-hmm.
And I'm gonna bend the elbow, and I'm gonna increase the stimulation. Just remember, when you go from the below the elbow to the above the elbow, decrease the stimulation a little bit, because this nerve is very superficial. You're gonna get the patient to just arm flat on your
Okay.
face,
Okay.
which happened to me on my first test.
All right.
Very first test. I'm like, my hand is right here, and I got wires, electrodes everywhere, and the patient is here, and I had their hand right there, and I go like this, and their hand went like, boop, and it hit me.
Hit you in the face. That's funny. Payback.
Payback, right? And then after that, we go and do the what? F wave.
Yeah.
This is the most technical one, in my opinion.
Okay.
The ulnar motor.
Okay. Yeah, it seems pretty.
It's very technical, but
Yeah.
once you get it down, it's like, boom, boom, boom.
Okay.
Right? Now, we're gonna get to the F wave interp. And this is gonna go for all 4 F waves we test. Median motor F wave, ulnar motor F wave, peroneal motor F wave, tibial motor F wave. Upstairs, downstairs.
Right.
They're all the same. We stimulate 10 times, we need to have 7 out of 10 present.
Okay.
They need to be between 30 and 70 milliseconds. If it's going to be above 70, it's delayed. What does delayed mean?
Late. Frequency. What? I don't know. 10 times.
Take a minute, take a minute.